The state government says Victoria's COVID situation could get worse before it gets better. The outbreak has grown to 54 after 11 new cases were found. 4,200 close contacts of known cases are being monitored by authorities. It's been another strong day for testing. Close to 44,000 Victorians fronted up for a test in the past 24 hours, and more than 16,000 vaccine doses have been administered. But it's what's happening in aged care that has experts most worried. Bridget Rollison begins our coverage.
The most heart-wrenching scenes from 2020 repeated.
We wouldn't be human if we didn't say that we weren't concerned.
Leaving many questioning, was anything learnt from last year's deadly mistakes?
Everyone else in aged care who has died from COVID-19 since this pandemic began has virtually died in vain.
There have been 11 new cases in Victoria, 3 in aged care, including a 99-year-old resident from Arcare Maidstone. She's had her first COVID-19 vaccine dose and is being monitored in hospital.
The fact that this outbreak has crept into a number of private residential aged care facilities is obviously of very great concern.
Wastewater is also being tested after a second Arcare worker tested positive. She is not vaccinated, while a worker at the Blue Cross facility in Sunshine has also been infected. Some aged care residents and workers have still not had their first dose. Families of vulnerable Victorians are upset it's taking so long.
That's disappointing. That should have happened. That should have been prioritised. As simple as that.
There is no doubt that this situation is incredibly serious. The next few days remain critical, and I want to be really clear with everyone that this outbreak may well get worse before it gets better.
2 more aged care centres were placed into lockdown as a precaution after staff members worked at multiple private aged care homes, despite the practice being banned in public facilities.
It's completely unsafe to have workers who are unvaccinated working in multiple aged care settings where the residents aren't all vaccinated either. It's just appalling.
Public aged care is a responsibility of the state government. Private aged care is a responsibility of the federal government.
I don't think Victorians care which government's getting it right as long as somebody gets it right.
There are now more than 300 exposure sites, some dating back as early as May 12. One case worked at this soft drink manufacturer in Thomastown over a 2-week period while infectious.
We're neck and neck with this virus, and it's an absolute beast.
While politicians continue to finger point, Victorians have their fingers crossed that this lockdown will end on Thursday. But an extension is looking more and more likely. Health authorities concerned not only by the number of cases but the type, with infections occurring in the most high-risk settings. Bridget Rollison, ABC News, Melbourne.
State political reporter Richard Willingham joins me now. So, Rich, it's unclear as to whether this lockdown will in fact end on Thursday, but what about other restrictions? Is there a chance some of them could be eased in regional Victoria at least?
Well, the acting Premier very much leant in today to describe the situation as it's getting more and more out of control, and you get the feeling from inside government that they don't think that the lockdown will lift on Thursday. They haven't made that call yet, and they'll be guided by the data over the next 24 hours. But the good news, I guess, for regional Victoria is there hasn't been any positive cases yet there. Now, there's more than 300 exposure sites across Victoria, but most of those are in Melbourne. There are some outside of the city. But that may give the government some wiggle room to perhaps bring back that so-called ring of steel and have maybe one set of restrictions for Melbourne, one set for regional Victoria. Now, the government hasn't made any decisions on any of this. They will continue to watch the numbers, but they were certainly not ruling that option out today. And perhaps we get to Thursday and there's some restrictions eased for Melbourne, but they might be very minor. But again, it's the next 24 hours and the government will be closely watching all those cases come in. They're obviously very spooked by the fact we've had some cases that were infectious and they were sick for some time before actually getting tested, which makes those exposure sites so great. And of course, now we have the aged care issue.
And Rich, given this is our 4th lockdown now, how do you think the government's handling the messaging around its policies and the scrutiny of them this time round?
Well, Victoria is the only state that's had 4 lockdowns, but the state government has been right out of the blocks trying to pin this elsewhere. And they make the very valid point that the genesis of this outbreak is in failures of South Australian hotel quarantine. And it's quite staggering that some of the lessons that were hard learnt and hard won here, I guess, with hotel quarantine haven't been shared or picked up by other states. And they were also very keen to point out last week that you've had issues with vaccination rollouts being very slow. And now this aged care issue, it really does highlight that's a federal government domain. You heard their language in Bridget's story there about this is federal government responsibility. Now, for that point, the federal government is looking at whether the workers in aged care should have mandatory vaccinations, with the government defending its record so far. Here's political editor Andrew Probyn.
100 days into the vaccine rollout and winter starting tomorrow, a long wait not deterring these Melburnians.
It's something that needs to be done to keep the community safe.
We thought we'd come down this morning even though it's 3 degrees. Just want to get in and out. Yeah.
More than 630,000 COVID shots were administered nationally the past week, but some critical frontline staff are still waiting.
The aged care workforce have only been given the leftovers from a site visit from the Commonwealth.
Victoria knows only too well how lethal COVID is to our most vulnerable. 655 aged care residents died in last year's outbreaks. The virus often spread by staff working across different sites.
This latest outbreak in aged care is a direct result of Scott Morrison's gross negligence and dangerous complacency.
A Commonwealth directive preventing aged care workers completing shifts at multiple homes was dropped late last year.
It's not clear to me the basis on which the government decided that that was no longer necessary in November.
The order reinstated for Greater Melbourne late last week by the Chief Medical Officer, but only for a fortnight.
He acted once he saw that in Victoria there was the possibility of considerable community transmission.
As to why it's not mandatory for aged care workers to be vaccinated, the Health Minister says it's on the advice of medical experts, although that's now to be tested.
The Prime Minister and myself have asked the medical expert panel to review that decision.
I haven't heard a good argument against vaccinating people who work in close proximity with vulnerable Australians.
Vaccinating aged care residents, but not all workers, is like locking the front door and leaving the back door wide open. Both residents and workers were in the top priority group for the vaccine rollout from the start. So Scott Morrison's government will wear a political consequence if the Victorian outbreak spreads deeper into the aged care system. Andrew Probyn, ABC News, Canberra.
During the height of the pandemic last year, the wage subsidy scheme JobKeeper kept the economy afloat and workers linked to their bosses. And since it wound up, there have been lockdowns in Brisbane, WA and now, of course, Victoria. Amid the prospect of future lockdowns, who will support workers and businesses? Here's Daniel Ziffer.
Victoria locked down. With it, this sports medicine and fitness business in Melbourne.
We had over 350 appointments scheduled for this week across our 3 sites. We'll be doing well to transition 25% of those online.
But costs, like staff and rent, don't change. Estimates of the economic hit to the state range from $700 million to double that. Treasurer Tim Pallas asked the federal government to reinstate JobKeeper for a week or to match its $250 million support package. He says both were turned down.
Out of frustration, I said, well, tell us what you're prepared to do. And the simple answer is they're not prepared to do anything.
Each lockdown means it becomes harder and harder for some businesses to keep going.
I mean, if we can do support around other emergencies and disasters, which happens, we've actually got to look at that now.
This is Victoria's 4th lockdown since the pandemic began. But with breaches from hotel quarantine resulting in lockdowns in Queensland, Western Australia and Victoria twice this year, the issue is unlikely to go away.
We need to have a situation where the federal government steps up and puts support on the table. There is simply no excuse for not doing so.
Business wants certainty.
We need state governments and federal government to work together on this to ensure that there are clear lines of support for business to get through this.
This is not the end of it. We need to learn how to live with it. There's a lot of unknowns and it's extremely difficult to be operating a business with so many unknowns.
Daniel Ziffer, ABC News.
The possibility of a long lockdown is weighing down heavily on Victorian families. School kids return to remote learning today, and after surviving last year, parents and caregivers are having to do it all again. Tom Maddox reports.
It's day one of remote learning, and this Gisborne family is taking a break.
Can we get the ducks?
Remote learning is hard going, but for mum Meredith Clark, it's particularly difficult. Her two boys, Cade and Archer, have autism.
I'm not feeling great about it. We didn't do well last time.
After getting through 2020, Meredith hoped the kids could catch up.
It's quite scary to think of what's going to happen to the children in the long run with this kind of education that's missed, to the point that the kids are starting to feel it's quite normal to not be at school, not be at work.
If you stay home for school, you can make yourself not do any work and just play on your iPad or outside.
Archer, Cade and Isla might be staying home for school for some time.
The needle moved a little bit today towards less likely that we'll be coming out of lockdown on Thursday or Friday, unfortunately.
But epidemiologist Professor Tony Blakely says there's good news. There do not appear to be any more mystery cases. And while the outbreak has leaked into aged care, it can be quarantined effectively from the community.
The other concern, though, is simply the fact that we've got another 6 and we haven't even completed the official 24-hour monitoring reporting period, and we've got so many contact sites.
Big schools are among the newest exposure sites identified, including MLC and Mercy College in Melbourne's east and north. In regional Victoria, there are no cases, but officials are taking it day by day.
There are still a number of primary close contacts in regional Victoria, a number who've tested negative, but we don't know what might be around the corner.
Despite the unknown, it's clear Archer wants to go back to school.
Personally, in my opinion, school is way better than I used to think.
A lot of Victorian school children and their parents feel the same. Tom Maddox, ABC News, Melbourne.